When people are started on these peptides, they actually report seeing changes. Now, here is the part of this conversation that most videos either skip entirely or mention it in a 2-second disclaimer at the end. If you're curious about your own growth hormone picture, start with your labs. A 44-year-old patient walked into my office last month. Engineer, active person, no significant medical history. But he handed me a printout from an online forum, a dosing protocol for CGC 1295 and Ipamorelin that he had already started himself. No labs done, no physician evaluation, just showed me a forum post and a promise on that which showed muscle increase, fat loss, and feeling 10 years younger again. And I had to tell him something he wasn't expecting to hear. So if you're also someone thinking about the peptide combination, or you have already started it, then stay with me till the end of the video. Because there is real science in these peptides here, but there is also real risk that almost nobody online is being honest about. I'm Dr. Sajid Burud, an internal medicine and a longevity medicine physician. I'm here to give you the conversation you deserve to have with your doctor. So let me be precise about what CGC 1295 and Ipamorelin actually are. They are peptides, short chains of amino acids that function as growth hormone secretagogues. That means they stimulate your pituitary gland to release more of your own growth hormone. This is not the same as injecting growth hormone directly. CGC creates a sustained background signal. Ipamorelin delivers pulses of growth hormone release. Stack them together and you're getting more signal, more rhythm, more of your own physiology working. That phrase, your own growth hormone, is exactly why people are drawn to this stack. They hear natural stimulation and immediately assume safe. And that's where the thinking breaks down. Natural does not mean harmless. Popular definitely does not mean well understood. Now, let's be honest about the benefits. The biology is real. The appeal makes more complete sense. People in their 40s and 50s feel like their body is working against them. They have slower recovery, harder to hold on to muscle. There is stubborn fat that wasn't there a decade ago. And then something comes along that promises to help your body produce more of its own growth hormone and the benefits of it. Of course, people will be interested. So when people are started on these peptides, they actually report seeing changes. First, they usually see better sleep, more restorative sleep, waking up less depleted. After that, they see changes in their recovery, less soreness, faster bounce back from training. Then comes the body composition changes, like fat loss, leaning out, preserving their muscle. But this takes longer, weeks to months. And that also depends entirely on whether they're training also and they have a consistent, good nutritional diet. So the fundamentals have to be in place. I could give an example of another patient I had who was a 38-year-old female. She had solid labs and a disciplined training program. She showed meaningful improvements within 2 to 3 weeks of starting these peptides. And why was that? Because her lifestyle was already strong with the right food and the right daily exercise. And this combination of peptides only amplified that. So if your fundamentals are weak, this stack will not rescue you. At best, it amplifies what you're already doing right. Now, here is the part of this conversation that most videos either skip entirely or mention it in a 2-second disclaimer at the end. The risk. Let's talk about them properly. First, immune reactions. Your body can recognize these compounds as foreign. The FDA has flagged immunogenicity as a real concern with peptide compounds. In rare cases, the reaction can be serious. And when someone is self-injecting substances purchased online, rare becomes a lot less comforting. Second, the cancer question. I want to be precise here. Current evidences does not show that CGC 1295 or Ipamorelin directly cause cancer. But growth hormone and IGF-1 are involved in cell growth and proliferation. So if someone has an active cancer, a recent cancer history, or a high-risk situation, stimulating these pathways is not a casual decision. Third, the metabolic effects. Growth hormone-related pathways affect glucose regulation. So for anyone with pre-diabetes, insulin resistance, with type 1 or type 2 diabetes, this is not a harmless wellness add-on. And then we have to remember the everyday side effects, injection site reactions, water retention, headaches, flushing, joint discomfort. They're not life-threatening, but they matter when nobody is monitoring you on these. Here is what actually concerns me most as a physician. Most people using these compounds are not going through proper medical channels. They're buying online, following forum dosing, copying influencer protocols, treating a clinically active, a hormone active compound like a protein supplement. So, what should be done before anyone starts these stacks? A comprehensive lab panel, a review of metabolic health, cancer history, cardiovascular picture, and a clinical evaluation by a physician who understands what they are looking at. Because, in my experience, many of the people who believe they need growth hormone support actually have poor sleep, low testosterone, insulin resistance, or are simply overtraining. Now, these are fixable problems even without peptides. If the basics aren't addressed first, you are using advanced tools for basic problems, and that never ends well. One more thing, for competitive athletes, growth hormone secretagogues are on the World Anti-Doping Agency Prohibited list. This is a disqualifying factor. So here is where I will summarize this stack. CJC 1295 and Ipamorelin, there is a real biology here. The mechanism is sound, the interest is legitimate, and for the right patient, properly evaluated and appropriately monitored, there is a clinical role. But this is not a supplement. It is not a biohack you order online. It is a clinically active compound that requires a clinical conversation. If you're curious about your own growth hormone picture, start with your labs. Talk to a physician who understands this medicine and not the one who just treats problems after they appear. If this gave you something meaningful to think, please do subscribe, like, and comment. I'm Dr. Sajid Burud, and thank you for watching. I'll see you in the next one.